Hi, I'm Dr. Ben Zellner, orthopedic hand and upper extremity surgeon at OSMS. I'd like to tell you about 3 hand and wrist procedures that can be performed in our procedure room. The procedure room is used for office-based procedures. These are different from an outpatient surgery at the surgery center in that they don't require general anesthesia or any sedation. This means patients are wide awake during the procedure. Instead of anesthesia, a numbing medication is injected into the surgery site to freeze the area. Patients don't feel any pain after this is done. We use the same surgical techniques and tools for surgeries in the procedure room as we do when we perform them at the surgery center or hospital. There are several benefits of using the procedure room. First, since no sedation or anesthesia is used, patients can drive themselves to the surgery and home right afterwards. Patients are allowed to eat up until the surgery time. The average time spent in the clinic is significantly less than with sedation. No preoperative labs or primary doctor clearance is usually necessary for these procedures. There is also more one-on-one time with the surgeon to review the procedure as it is happening and, more importantly, to discuss what is safe to do after surgery. This can speed up recovery. On average, a surgery performed in the procedure room will cost about 50% less than the same one performed at a hospital or surgery center. Let's look at a few of the procedures we can perform in this setting. Carpal tunnel syndrome occurs when the median nerve, one of the main nerves that travels from the neck down the arm and into the hand, is compressed at the carpal tunnel as it passes through the wrist. This puts pressure on the nerve and causes pain, numbness, tingling, and sometimes weakness. Symptoms are felt typically in the thumb, index, middle, and half of the ring finger. Some patients have a lot of pain at night in addition. Many patients will respond to splinting and modifying their activities, but others may require a small procedure. Carpal tunnel release is a procedure that opens up the carpal canal to make more room for the median nerve. This releases pressure and typically relieves symptoms. Even the night of surgery, patients often sleep better. Trigger finger affects the tendons and pulleys that bend the fingers. When the pulleys become too thick, the tendons can't easily glide through them to create movement, which causes the finger to lock in a bent position. When non-operative measures fail, surgery is often successful. The procedure room surgery will open the pulley at the base of the affected finger to prevent the locking. During surgery, the tendon is visualized gliding freely, and if the patient desires, they can even see the tendon themselves. We find that awake patients are able to be more active in their own care, and oftentimes this increases the understanding of the rehabilitation process. This may even accelerate the recovery time. Another surgery we can perform in the procedure room is a tendon repair or transfer. Tendons are tissues that connect muscle to bone. When a tendon is damaged, certain muscle movements may not function properly. Ideally, when a tendon is injured, the area surrounding the tendon can be frozen or numbed to allow repair. Doing this in a patient who can cooperate with movements after the repair ensures that the repair is strong enough to withstand the forces the body needs. If a tendon cannot be repaired, tendon transfer is an option. During tendon transfer, we replace the damaged tendon with a healthy one to restore function. This is possible because in some areas of the hand there are 2 tendons that perform the same task or movement. So we are able to take this essentially extra tendon and use it to restore function in a deficient area. For example, most people have 2 tendons that straighten the index finger. Therefore, if the ring finger tendon becomes damaged, we can use one of the index finger tendons to replace the damaged ring finger tendon. Then both fingers would be able to function properly. Again, performing this in a patient who can cooperate with movements during the procedure leads to a better outcome for the tendon and a better understanding and compliance with the rehabilitation process.